For our safety analysis project, our group decided to focus on ineffective handoff communication within the hospital. This can be such a threat to patient safety, and we found that a large percentage of errors involve miscommunication during handoffs and transfers. We thought handoff safety was an important focus since it's something we will always be a part of and participating in with nursing. Whether it be between shifts or between floors, human factors are the largest barrier to causing errors at any of these times. We will be looking into what factors influence unsafe handoffs and interventions to implement in order to improve the miscommunication that can occur.
A handoff is a mechanism of communication between one or more caregivers. The handoff must provide critical information about the patient, include communication methods between the sender and receiver, transfer responsibility for care, and be performed within complex organizational systems and cultures that impact patient safety. Handoffs can either be verbal or written and can involve many different types of subspecialties, such as physician-to-physician handoffs, nurse-to-nurse handoffs, and in special settings such as the operating room or emergency department. Because so many different types of handoffs exist and because they occur so frequently, handoff errors are not uncommon and can be classified as a type of medical error. One of the major causes of faulty handoffs is a lack of communication between healthcare providers. And because of the organizational complexity of hospitals, often there are numerous providers involved in each patient's care, leaving plenty of room for handoff errors. The impact of ineffective handoffs or transfers includes adverse effects such as delays in diagnosis or treatment, fragmented care, breaches in care, medication errors, conflicting communication, duplication of procedures or tests, and lower provider and patient satisfaction rates, as well as higher costs, more frequent hospital stays, and even patient deaths. There are many stakeholders involved in handoffs, specifically in nurse-to-nurse handoffs, which typically occur at the shift change. The key players include the nurse delivering the handoff, the nurse receiving the handoff, and the patient. The benefits of using a standardized checklist to complete handoffs apply to all stakeholders. It can help the nurse delivering a handoff to present accidental omission of critical patient information. It can help the nurse receiving handoff to organize all important information that she or he has received, and can also allow the patient to be involved in the bedside report process, which can help reduce medical errors. Other potential stakeholders include the charge nurse, physicians, and other clinicians that might be involved in patient care. However, their role is minimal when speaking specifically about nurse-to-nurse handoffs. Because healthcare is a complex adaptive system that is embedded within itself, involves distributed control, and is self-organized, the healthcare system can naturally combat errors in handoff. Embeddedness allows for small changes to have a widespread effect on the system. Distributed control in a system that is highly specialized means that multiple clinicians are involved in the care of every patient, and when each part functions properly, the end result is teamwork and excellent patient care. However, whenever there is dysfunction in the complex adaptive system, it results in unequal control or a lapse in communication, which can lead to medical errors such as handoff errors. And finally, because the healthcare system is self-organized, healthcare professionals have the ability to adapt to the often chaotic tendency of the complex adaptive system. The use of standardized handoff checklists highlights organizational needs and allows clinicians to work with one another to accomplish all tasks needed and prioritize them, resulting in a reduction of medical errors, including handoff and medication errors.
Okay, this is Darla. We don't really need to go in there. She's sleeping last time I checked. She's an 80-year-old female. She was admitted for a UTI. She's on antibiotics, Cipro, IV. She's consistently confused. She has a history of osteoporosis. Also has a right hip fracture. Nothing else really important about her. Is that all you need?
Yeah, I should be able to remember it.
Great.
Thank you.
Yeah.
How are you doing today?
Oh, hello. I need to use the restroom.
You need to use the restroom?
Yeah.
I think I heard that you're able to just get up Just with one person, right?
Oh yeah, that sounds fine.
I think that's what the nurse said.
Okay.
Here we go. Oh.
As you can see, lacks in communication during handoff can result in serious sentinel events.
So a few recommendations or solutions that we came up with to try and combat or improve this problem of handoff errors would be to incorporate 3 different kind of styles of improving the communication and bridging that communication gap between nurses. And the first solution or recommendation would be to incorporate some kind of structured mnemonic communication tool. And obviously we've already had some experience with having to do SBAR communication or conversations, and basically some of the benefits of these mnemonic communication tools would be that firstly it just provides organized patient information by, obviously, for example, taking SBAR, the conversation is kind of laid out with, what's to be included so that the recipient or whoever's on the other end of the conversation receives all of the pertinent information from the handoff nurse in this situation. And then in addition, it also encourages effective and active listening skills because it requires the nurse to, listen and go through kind of the process and fill out the mnemonic in the back of their head or even, on a sheet. And then finally, it just serves as an easy reminder of the most pertinent information to be received during handoff. Just like I said, by most importantly, having something that's already structured and then going through each different mnemonic or acronym just to kind of see if there is the important information being relayed across. It's a little more difficult just to try and come up with some possible cons or complications with this structured mnemonic tool, just because it is something that is often and widely used in the hospitals and seems as if it's fairly effective, but just some possible cons could be that it is too broad and doesn't include enough or require enough of the client information. For example, SBAR, you are only looking at situation, background, assessment, recommendations, and SBAR may not be completely applicable to every patient's current situation. And then also it could become overly repetitive, just like we may feel with SBAR now. And then finally, it might not be the preferred method of nurses to organize patient information in this way. Obviously, everyone has their own system, which can become problematic, but essentially, nurses could have one preferred method, and these mnemonic communication tools may not be their preferred method. Our next solution or recommendation would be to incorporate design methods that verify information transfer with closed-loop communication tools such as checking back or reading back to another nurse. And basically what a nurse would do that's receiving report or going through the handoff process would be just to clarify the information back to the nurse. And basically the benefits of this are obviously, like I just mentioned, is that it provides a clarification of the important patient information and kind of fills those communication gaps or maybe misunderstandings that may have happened. And essentially that basically leads to reduced medical error from the miscommunication or misinterpretation of information. And then finally, it enhances the concept of teamwork within the nursing realm, just because there are nurses having to participate in more of a conversation rather than just one nurse giving a quick brief report while the other listens. There's the check and balance between making sure that all of the most pertinent information is being held and being received, and then also being prioritized by the nurse that's now taking over shift. And then some possible cons or complications with this specific recommendation could be that, firstly, it may just become overly time-consuming and inconvenient, especially for those nurses that had just finished shift, obviously having to, sit there and listen back to all of the information that the nurse receiving report just heard, and that can, sometimes be time-consuming. And then especially if the nurse has, greater than 4 patients, having to participate in more lengthy conversations may become inconvenient and a little too lengthy. And then also a possible complication would be that it just relies too heavily on the verbal communication and listening skills rather than, jotting down the information to make sure that, if a nurse has to come back to that particular patient, she or he is not relying solely on just having to remember and kind of go back through her memory and make sure what she heard in report is still accurate. And then also it doesn't necessarily allow a nurse to easily differentiate or separate one of her or his patient's information from another, just because it's, like I just said, so heavily relies on that verbal communication and not necessarily jotting down the information in some kind of systematic way or format. Finally, our last recommendation or solution would be to kind of adopt a standardized checklist that includes the most recent or pertinent information about a patient's current status or condition. And what these checklists would look like would be, listing all of the either medications or if there's fluids running or, what the pain level is at, and basically it just allows the nurse who's receiving the handoff or report to go through a checklist to kind of try and prioritize their care and see, what action needs to take place first. And then another benefit of this would be just that it implements a degree of accountability because it's requiring all nurses to go through the same checklist. And then again, that kind of incorporates some level of consistency as well, because every nurse is going to have to go through these checklists and prioritize their care in a certain way, which just, with the consistency helps a lot within the hospital setting. Once again, it's just may not be the preferred method for nurses going through the checklist. Once again, everybody has their own way of doing things and prioritizing their care, and these checklists may not be the exact method of preference. And then it also may not include enough of differentiation for each patient. These checklists are not patient specific, and obviously no patient's condition is the same, and so having just a standard checklist may not be totally applicable to each patient. We decided that our final recommendation would be just to implement a standardized communication tool or checklist, which essentially requires nurses to just provide that specific and pertinent information regarding the patient's current health condition and allows for that level of consistency and accountability by requiring nurses to go through the same standardized checklist and have that specific structured conversation between the nurses, and just to make sure that patient outcomes are going to improve just because there is no miscommunication or misinterpretation of information. And then also we would hope that this would decrease the likelihood of lost information and just basically increase the accuracy of the handoff and making sure that the nurse that's receiving report is receiving all of the most important information and detail about the patient, and that there's going to be no chance of error just because the conversation and the communication is being effectively structured.
Good morning, Darla.
Alright.
How are you doing today?
Alright. A little tired.
Oh, I'm sorry to hear that. I have your new nurse, Ellie, here with me today.
Hello.
Hi, Darla.
Hi.
We're going to be taking care of you today. I'm heading out for the evening, but I'm going to give her a report on how you're doing, okay?
Okay.
Feel free to add anything.
Okay.
All right, so this is Darla. She's an 80-year-old female here for a urinary tract infection and consistent confusion. She also has a fracture in her right hip. She is on bed rest. She's on Cipro, Q12 hours, IV. She has a regular diet, and she's been kind of confused lately. We had some troubles during the night. She was trying to get up out of bed, so just keep an eye on her. We do have the bed alarms on, so hopefully you won't have any problems today.
Awesome. Thank you.
Do you have any other questions?
I don't think so.
I have to pee.
Do you?
So just to make sure she is high fall risk, continue to keep up on her antibiotics for the next dosage, and then otherwise just keep her rested and be aware that she's not getting out of bed, and then hopefully just get her on a bedpan and make sure she's not trying to get up.
Yep, exactly. She has a very high fall risk.
Awesome. Thank you.
Thank you.
So there are a few ways we would be able to evaluate the effectiveness of our recommendation or solution. And the first being that we would hope to see less reported medical errors on the specific floor or within the hospital setting. And just because, there is no more miscommunication or misinterpretation, and nurses are all well informed of, who their patient is and what his or her status is. And then kind of relating to that, we would hope to also see fewer sentinel events occurring as a result of, that lack of communication, like I just said, or, nurses not being able to prioritize their care, or, maybe even confusing patient information and performing procedures or different tasks that are not specific to that patient. And so we would just hope to kind of clarify any of the miscommunication that could happen without these handoff specific communication tools. And then finally, we would hope to see a decrease in the amount of patient readmissions, once again, just because the nurses are able to, conduct all of their care that's specific to each patient. And, all three of these areas would not necessarily be just a result of incorporating some kind of handoff tool or effective communication guide, but we would hope to see kind of a correlation between all three of these areas and improving the communication and standardizing the communication between the nurses during handoff.